In the case of the wind turbine noise and its hypothetical relationships to wind turbine syndrome and vibroacoustic disease, there really haven't been any case control studies, cohort or longitudinal studies, which are really the studies that are used by International Agency for Research on Cancer, the Environmental Protection Agency, National Institute for Occupational Safety and Health, and so forth, to assess whether exposure to any particular substance is capable of causing any particular disease. So to conclude, the noise from wind turbines does not pose a risk of hearing loss or any other direct adverse health effect based on the information that's currently available in peer-reviewed scientific literature. There's some people that may become annoyed from the sound from wind turbines, but annoyance varies from person to person. Some people may be annoyed being stuck in a traffic jam or waiting too long at the post office or waiting too long for their son to come home at 2 in the morning on a Saturday night. I don't mean to minimize the importance of annoyance, but to make it clear, annoyance and the perception of annoyance is really, in many cases, an individual variability and an individual response. The major cause of concern from wind turbine noise is the fluctuating nature of the noise, the swish-swish sound. Studies and surveys repeatedly show that that is the most common cause for concern for people who live in the proximity of wind turbines. And clearly, some may find this noise very annoying. And it's a reaction that depends primarily on a lot of personal characteristics as opposed to the intensity of the noise. And subaudible low-frequency noise and infrasound from wind turbines do not present a risk to health. This isn't just my perspective or the perspective of the group. The French Academy, the studies in Britain, Denmark, United States have all drawn similar conclusions. And the wind turbine syndrome, as far as I am aware, is really not a new disease or an accepted medical diagnosis, but the collection of symptoms that have been reported in this context appear to reflect noise annoyance. Thank you very much.
So I just remind you with questions that you need to write them down. If you have them written down, want to hold up your cards, we'll have someone come around so we can begin collecting them as we go. So if you have questions that are emerging for you, just raise them up and raise them.
I'd like to thank Tom Huebner for inviting me here. It's a pleasure to be here. It's certainly always great to have an opportunity to drive through Vermont. I'd like to thank Dr. McCunney for coming as well. And I'd like to thank everyone here for showing up. I'm going to talk largely about the same issues. You'll find that I and Dr. McCunney agree on some, and we disagree on much. I'm going to talk about a little bit about the basics, and these will be, I'll try to focus on basics that nobody talks about, because I think that's important. I'll then talk a little bit about the experience in Mars Hill, Maine, which is a town with a ridgeline arrangement of wind turbines. I'll talk a little bit about, well, actually talk a lot about, if I have the chance, about the AWEA panel review, and then I'll have some conclusions. So I'll get started. What I will not talk about is VAD, or vibroacoustic disease, and I'm not going to talk about wind turbine syndrome either. What I am going to talk about is something that I know about and that I've researched myself in this setting, sleep deprivation, and how this applies to the setting of wind turbines. At the outset, I'd also like to say that a lot of the literature from Europe is great, but much of the literature relates to wind farms where the turbines are significantly smaller than some of the turbines that are going up in the US at this time. Generally, the turbines that were placed close to where people live in Europe were significantly smaller, 0.6, 0.4. Only recently have they been of the industrial size that we're seeing in the US. And now that the larger turbines are going up, particularly in the UK, there have been a lot of complaints. So the question, of course, is it the wind turbines that are causing these complaints, or is it something within the people themselves that they just respond in a negative fashion to turbines, and therefore they find the turbines unpalatable? There's several factors to consider with wind turbine noise. It's the turbines themselves, the terrain and weather, and then what the industry calls receptors, and what you and I would call our homes and families. It's worth noting that mechanical noise that Dr. McCunney referred to is really not an issue except for some of the older turbines, or if a turbine is in poor maintenance. What we're talking about is aerodynamic noise that comes off of the tips of the blades. frequency ranges of sound. And I'm not going to give you a lot of graphs. I'll give you just a few that I consider critical, but it's critical to understand these graphs. This is the range of sound here. What we have in sort of the light blue is what's conventionally considered human hearing. In the dark red below, we have the infrasound range, which is from about 16 to 20 down to 0. And you'll see that wind turbines are putting out noise that spans both the inaudible or conventionally inaudible range as well as the audible range. So with turbines, there is infrasound, but there's so much more. And I'm not going to focus on infrasound or make all sorts of claims about infrasound. I think we have our hands full just dealing with what's audible. Sound travels. Lower frequency sounds travel farther. And we see that in medical ultrasound, for example. The image on the left is the thyroid gland, which is a very superficial structure in the neck, where we have a little nodule. We use a very high frequency transducer to see that. On the other hand, a baby in the womb is about 5-6 inches deep, and we use a lower frequency transducer to see that. Similarly, the sound from a DR wood chipper, which is at about 105 decibels, will not travel as far as a sound from a locomotive, even though the sound level at the point of origin is similar. Lower frequencies travel further. This is a sound spectrum from a turbine at Mars Hill. This is obtained at midnight, and you can see that most of the sound energy is in the lower frequencies. Why is this important? Well, these are the audible low frequencies, and these frequencies will have effects, if not on you yourself, they'll have effects on your dwelling. So everyone's hear that? Feel it? Hear it? Now, Dr. McCunney referred to what people hear at what decibel level. And it is very dependent on frequency. And this is an equal loudness contour graph, which I took out of the AWEA report. And these graphs reflect average values. And they're obtained with pure tones. So they are not necessarily reflective of what's going on in the real world. We are exposed to what someone has called an acoustic pizza. We're not exposed to a pure tone. And this is important because this will have effects on what we can hear. I'm going to play you an 80 hertz pure tone. I'm going to play you 80 hertz, which is amplitude modulated, which just means the volume goes up and down at 3 times per second. Now I'm going to play it at once per second. Are those equally annoying or equally loud? Well, they actually are. They're all at the same decibel level. But the quality of the sound is different, and we perceive the modulated sound at a much lower decibel level than the pure tone that AWEA and most acousticians who work for the wind industry, they just use these graphs and they say, well, the wind turbine is producing sound at this frequency, at this level, we shouldn't be able to hear it. And they're going by these pure tone graphs. So is that concept clear, pretty much? Okay. That's a wind turbine at 1,500 feet. That's an 80 hertz tone, cycling once per second at the same decibel level, the same loudness level. So this is known. This is the way the human brain works. We know that pure tones at equivalent amplitudes are significantly less effective than complex tones at awakening people. This is a study